Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Aspergillosis. Introduction.
Aspergillosis can happen when mold called Aspergillus enters the body. Some types of this mold can make you sick, but most types don't do any damage. The damage usually affects the lungs and breathing tubes.
This program explains aspergillosis. It discusses the symptoms and treatment of illnesses caused by the mold Aspergillus. Aspergillosis. Molds are fungi that can live both outdoors and indoors. They grow best in warm, damp, and humid places. If you have damp or wet spots in your house, you will probably get mold. Molds can cause health problems. Inhaling or touching mold may cause allergic reactions or asthma attacks. Molds also can cause fungal infections. Mold exposure may irritate your eyes, skin, nose, throat, lungs.
Aspergillus is a common fungus that most people breathe in on a daily basis. It rarely causes problems in the body. Aspergillosis is a group of diseases caused by the fungus. It usually happens in people who have weak immune systems or who already have problems with their lungs. Aspergillosis can cause infections in the lungs and other organs. It can also cause an allergic reaction in people with asthma or cystic fibrosis. This type of allergic reaction is called allergic bronchopulmonary aspergillosis. It is also known as ABPA. Lung cavities are air spaces in the lungs. They may have been created by damage to the lungs. The damage could be from radiation to the lung or serious lung diseases. A growth of fungus may develop if there are air spaces in the lungs. The growth is called a fungus ball or aspergilloma. The most severe form of aspergillosis is called invasive aspergillosis. It happens when the infection spreads rapidly from the lungs. It spreads quickly through your bloodstream to your heart, brain, kidneys, or skin. It can often lead to death if untreated. Invasive aspergillosis happens only in people with weak immune systems.
Aspergillosis may affect other areas of the body, such as the sinuses. Symptoms.
Signs and symptoms of ABPA include asthma that is getting worse, blood or phlegm that comes out when you cough, fever. If you have an aspergilloma, over time you may notice a cough with blood in it, tiredness, shortness of breath or wheezing, weight loss without trying. Invasive aspergillosis can cause different symptoms depending on what body parts it affects. Symptoms can include chest pain, a cough with blood in it, joint discomfort, facial swelling on one side. Invasive aspergillosis can also cause nosebleeds, skin sores, fever, chills, shortness of breath, bleeding in the lungs that could lead to death. If aspergillus invades the sinuses, it can cause bloody drainage, a stuffy nose or pain in the face, headache, damaged bones in the face, fever, inflammation. If you have asthma or cystic fibrosis and you notice a change in your symptoms, see your healthcare provider. Seek medical care right away if you have a weakened immune system and you develop fever that happens without a clear cause, a cough with blood in it, shortness of breath. If you have invasive aspergillosis, you must get treatment right away. Treatment may begin even before diagnosis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes.
It is almost impossible to avoid Aspergillus in the environment. This is because it is found on plants, trees, grain crops, dead leaves, and compost.
Indoors, Aspergillus mold thrives in air conditioning and heating ducts, insulation, some food and spices. Aspergillus is common in old buildings.
People with strong immune systems usually don't get sick from everyday exposure to Aspergillus, but people with weakened immune systems can't fight the mold as well and may get sick. Aspergillosis is not contagious, so it cannot be passed from one person to another.
Risk factors.
Several factors make you more vulnerable to infection. These include a weakened immune system, a low number of white blood cells, certain problems that affect the lungs, such as tuberculosis, sarcoidosis, emphysema, asthma, ankylosing spondylitis, and cystic fibrosis, corticosteroid therapy that lasts a long time, a hospital stay. A weakened immune system is the greatest risk factor for invasive aspergillosis. People at greatest risk include those who use medication that suppresses the immune system after having a transplant procedure, have an advanced stage of AIDS, have some types of cancer. White blood cells help fight fungal infections. Having too few white blood cells puts you at a higher risk of developing invasive aspergillosis. Chemotherapy, leukemia, and a transplant procedure can all lower your white blood cell count. Having asthma or cystic fibrosis makes an allergic reaction to Aspergillus more likely.
Diagnosis.
Aspergillosis looks like many other types of mold under a microscope. In addition, many of the symptoms of aspergillosis are symptoms of other diseases as well. For these reasons, diagnosing aspergillosis can be hard. Your healthcare provider may do the following tests. A chest X-ray or CT scan. Imaging tests can often show a fungus ball. Respiratory secretion or spit test. Tissue and blood tests. Biopsy of the lungs or sinuses. Diagnosing ABPA usually requires skin and blood tests. A skin test involves an injection into the arm. The blood test requires a blood sample. Both tests can tell whether you are allergic to Aspergillus.
Treatment.
Depending on the type of aspergillosis, treatment may involve watchful waiting to see if the condition improves or gets worse, antifungal medicines, surgery in some cases. People with aspergillomas usually don't require any treatment. If you don't have symptoms, you may get X-rays from time to time to make sure the condition isn't getting worse. ABPA can be treated with oral corticosteroids. These can help prevent inflammation, asthma, and cystic fibrosis from getting worse.
Antifungal medicines by themselves are not helpful for ABPA, but they may be used along with corticosteroids. This reduces the dose of steroids. It also improves lung function.
Invasive pulmonary aspergillosis is usually treated with antifungal medication, but all antifungals can cause serious problems. They may cause kidney and liver damage. They often interact with other medicines given to people who have weakened immune systems.
Surgery may be needed to remove a fungal mass when bleeding in the lungs happens due to the mass, but the surgery is risky. Your healthcare provider may instead suggest embolization.
During embolization, a healthcare provider threads a small catheter into the artery that supplies blood to the fungus ball cavity. A material that clogs the artery is injected. Though this procedure can stop massive bleeding, it does not prevent it from happening again. It is a temporary treatment. It's almost impossible to avoid Aspergillus entirely, but people who have had chemotherapy or a transplant procedure should avoid construction sites and other places where mold tends to grow. If you have a weakened immune system, you may need to wear a face mask to help protect you from breathing in germs.
If you like this video, please like and share.
For similar videos, subscribe to our channel.
Summary.
Aspergillosis can happen when mold called Aspergillus enters the body. Some types of this mold can make you sick, but most types don't do any damage. The damage usually affects the lungs and breathing tubes. Aspergillus is a common fungus that most people breathe in on a daily basis. It's almost impossible to avoid Aspergillus in the environment. People with strong immune systems usually don't get sick from everyday exposure to Aspergillus. But people with weakened immune systems can't fight the mold as well and may get sick. Several factors make you more vulnerable to infection. These include a weakened immune system. This could be due to AIDS or medication taken after a transplant procedure. A low number of white blood cells. Corticosteroid therapy that lasts a long time. Certain types of cancer or cancer treatment. A hospital stay. Other conditions that affect the lungs may put you at a higher risk of infection. These include ankylosing spondylitis, asthma, cystic fibrosis, emphysema, sarcoidosis, tuberculosis. Depending on the type of aspergillosis, treatment may involve watchful waiting to see if the condition improves or gets worse, antifungal medicines, surgery in some cases. It's almost impossible to avoid Aspergillus entirely, but people at high risk should avoid construction sites and other places where mold tends to grow. Thank you for using Explain.